Our top story this morning, Canada's Expert Advisory Panel on Immunization, NACI, will release new guidelines on COVID vaccine booster shots this morning. We're expecting it to recommend an extra dose for anyone 50 and older. A policy already adopted in 7 provinces and territories. The announcement comes as Canada reports more infections from the Omicron variant. A total now stands at 11 after Ontario and Alberta reported new cases yesterday. Well, for more on all of this, let's bring in Dr. Sumon Chakrabarti. He's an infectious diseases physician with Trillium Health Partners, and he is in Mississauga this morning. Good morning, Dr. Chakrabarti.
Good morning, John.
A lot to try to understand here, as always, but perhaps even more so these days. We're expecting a new guidance from NACI later this morning on booster shots. What do we know about the potential efficacy of boosters? I guess maybe a two-parter there. One, in terms of the Delta that we're still dealing with predominantly, and also the looming concerns over Omicron.
Yeah, so let's start with Delta. I think that what's clear right now is that rather than a booster, we call it a third shot. The primary series third shot is something that certainly has a good grounding in evidence in individuals over the age of about 60, people with immune compromising conditions, and those in long-term care. I think that's clear. As you start to get into the younger groups, it gets a little more gray. I think the 50 to 60, I think it makes complete sense to give that third dose. But after that, we're starting to, the risk and benefit ratio is starting to get unclear. In terms of Omicron, we really don't know. It's early days, but I think there is early indication that people who are vaccinated are at less risk of becoming sick enough to become hospitalized. So that's what we know so far. But of course, this is evolving by the day.
The U.S. has announced new travel rules for international travelers entering by air, including Canadians. They're required to take an antigen test within 24 hours of their departure, so presumably within that window of departing and then arriving. How effective do you think these measures may be in slowing the spread?
Yeah, I've been having a lot of discussion with my colleagues about this, and we disagree. We all have a whole bunch of different views on this. In my opinion, I don't think it does that much. If you see how fast Omicron is replacing the Delta in certain areas of Africa, for example, you see the speed at which it replicates. And because of that, I don't think that any of these interventions are really going to make much of a difference. I do think, though, where the biggest yield is continuing to go with our vaccine campaign, getting people vaccinated with their first dose, and also getting boosters to people who are eligible for it.
On the other hand, Canada will not require travelers from the U.S. to take a COVID test before their arrival. This is, let's face it, inconsistent. And I guess the question is, how is this inconsistency potentially affecting the public's understanding of how all this is supposed to work?
Yeah, it's affecting my understanding too. I'm somewhat puzzled about this. And to be honest with you, I think this kind of outlines the uncertainty we have around a lot of these things. That, to be honest with you, travel bans, border restrictions, at this point in time, I'm not really sure what they're adding. And you can see this with inconsistencies across what countries are doing. So especially this one in Canada and US really makes for an interesting paradox. But to be honest with you, I think all of them really don't make much of a difference at this point.
Okay, that being said then, December well underway, holidays well underway, Hanukkah happening right now, and looking forward to so many other gathering points, if only for family members. But still, in view of all this, what's your advice for people in terms of what should be their guide in terms of making holiday plans?
At this point, I still say the same thing that I've been saying for the last couple of months, that it's a personal risk assessment. We're 2 years into this pandemic almost, and I think telling people what to do in their own house, it doesn't make a lot of sense to me. However, there is guidance of what you can do to layer to make things safe. We know having things outside, which might be a bit inconceivable now, but improving ventilation and just being vaccinated, of course, and doing things that everybody in the party is comfortable with. But at this point in time, people are going to gather. I don't think we can stop that happening. I think we just have to see what happens after the holidays. But again, the best defense that we have against severe disease is get vaccinated. And if you haven't gotten vaccinated now yet, I urge you to.
Well, I know of at least one backyard New Year's Eve party that I've already been invited to. So there you go.
Well, that'd be good. Good ventilation there.
Okay, exactly. Now, what about any advice you give to people in terms of making travel plans in view of all that we're seeing?
For me, the travel plans are less about Omicron and more about what can happen if certain things change. We can see these rules are changing quickly, and I'm more worried about people being stranded somewhere or not being able to travel back than I am about the variant itself. So I think that it's important to be very clear about what the requirements are for leaving or entering the country you're going to and coming back. And apart from that, again, I guess it doesn't really matter because if you have to be vaccinated to get onto the plane, but that's my big thing is just to make sure that you know exactly what the requirements are, both exiting and entering back into Canada.
So I guess the question is then, are you doing any traveling over the holidays?
Well, I have a third baby due at the end of the month, so I'm not going to be going very much. But that said, I think that I'll be seeing my family members. We're all vaccinated, and I think that it's been 2 years, and it's important for me to be with my family, and we're going to be adding another one, so it's going to be exciting. Okay,
so no travel plans in the Chakrabarti family.
Not yet.
Well, okay. Looking forward, though, to the next months and all that's circulating around, all the unknowns, all the question marks. What are you most concerned about?
I think that for me, we have all the same thing in infectious diseases is the uncertainty around what Omicron is going to do. We're seeing that it has the potential of rapid expansion. We don't know how serious it is yet. We also don't know how it's going to respond in a highly vaccinated country like Canada. Either way, I think that uncertainty is a bit unsettling. But that said, there is a possibility that it's not nearly as virulent. Again, I'm not going to make any predictions, but we need to be careful of this. And again, it does look like early indications say the vaccine works to protect you. So if you haven't gotten vaccinated yet, and I sound like a broken record, I urge you to do so. It's our best protection against any of these variants.
No, thank you for playing that record, Doctor. Appreciate it.
You got it.
Okay. Infectious diseases physician Dr. Sumon Chakrabarti, and he spoke to us from Mississauga, Ontario.